There's something happening right now, inside millions of Americans over the age of 60, and most of them have absolutely no idea. No pain, no obvious warning, no dramatic moment that makes them pick up the phone and call their doctor. Just quiet, invisible damage, building slowly, day after day. And here's what makes this so dangerous. The early signs don't feel like kidney signs at all. They feel like aging, they feel like tiredness, or a bad night's sleep, or maybe just getting older. That's exactly why so many seniors reach a critical point before anyone catches it in time. And if you're watching this right now, what I'm about to share with you could genuinely change the course of your health. So please, stay with me for the next few minutes because this is not something you want to scroll past. Let me tell you about a man named Harold. He was 71 years old, retired, still mowing his own lawn, still going fishing on Sunday mornings. His wife Margaret kept telling him he looked pale. He kept telling her he was fine, just tired. He'd been waking up twice a night to use the bathroom, which he figured was just getting older. His ankles had been a little puffy. He'd been feeling itchy around his lower legs for weeks, but blamed it on dry skin. His appetite wasn't what it used to be, but he figured stress. For almost 8 months, Harold's kidneys were sending him signals, and for 8 months, he missed every single one of them. By the time his doctor caught it during a routine blood test, Harold had lost nearly 40% of his kidney function. 40%. And he never felt a thing that screamed kidney problem. That's the terrifying reality we need to talk about today. The kidneys are two fist-sized organs sitting just below your rib cage, one on each side of your spine. They do something absolutely remarkable every single hour of every day. They filter your entire blood supply, roughly 40 times a day, cleaning out waste, balancing fluids, regulating blood pressure, and producing hormones that help your bones stay strong and your red blood cells stay healthy. They are working constantly, silently, powerfully. And for most of your life, they do this without a single complaint. But here's what most people, even most doctors, don't emphasize enough. The kidneys have a remarkable ability to compensate. They can lose a significant portion of their function and keep going, quietly picking up the slack, adjusting and adapting. Which sounds like a good thing, right? But it isn't. Because by the time your kidneys start struggling enough to produce noticeable symptoms, the damage is often already significant. That's what makes the early signs so easy to miss. And that's exactly why I want to walk you through them today, one by one, in a way that actually makes sense. Before I go any further, if you're finding this helpful, I'd love for you to hit that like button and subscribe to this channel. Here at Dr. Silas Redford Wellness, we put out videos every week designed specifically for people who want to take their health seriously in their 50s, 60s, 70s, and beyond. It's a warm, supportive community, and we'd love to have you in it. Now let's get back to what your kidneys might be trying to tell you. The very first sign is one that almost every senior I've ever heard about has explained away with the same words: I'm just not sleeping well. Fatigue that feels different from normal tiredness. Not the tiredness that comes from a long day or a poor night's sleep. This is a deeper, heavier exhaustion. A kind of bone-level weariness that doesn't go away after rest. The reason this happens is connected to something called erythropoietin, a hormone your kidneys produce that signals your bone marrow to make red blood cells. When kidney function starts to decline, production of this hormone drops. Fewer red blood cells means your organs and muscles get less oxygen. And when your tissues are starving for oxygen, you feel exhausted in a way that coffee and sleep simply cannot fix. Many seniors spend months, even years, chasing answers for this kind of fatigue. Thyroid tests, sleep studies, depression screenings, never once suspecting the kidneys. And that delay matters more than most people realize. Now here is something that might surprise you. One of the most overlooked early signs of kidney trouble is a change in how often you're visiting the bathroom at night. Waking up once or twice to urinate is something many older adults experience and usually brush off as just part of aging. But when the kidneys begin to lose their ability to concentrate urine efficiently, they start producing more of it at times when the body would normally be resting. So if you've noticed you're waking up more frequently than usual at night, 3, 4, sometimes 5 times, and this has become a regular pattern, it's worth paying attention to. Not because it definitely means something is wrong, but because combined with other signs, it can paint a picture that your doctor needs to see. And speaking of changes you might be brushing off, let's talk about what's happening in the bathroom during the day too. Changes in urine color, clarity, or frequency can be some of the earliest physical signals your kidneys will send. Urine that appears foamy or bubbly is one to take seriously. This foaming happens when there is protein leaking into the urine, protein that healthy kidneys are supposed to filter and keep in the bloodstream. In the early stages of kidney damage, protein can begin to escape into the urine before any other obvious sign appears. Some people notice this for months before saying anything. Others notice it and look it up online, see something alarming, and then decide not to think about it because they're afraid of what it might mean. I understand that fear, but I also want you to understand that catching this early is the difference between protecting your kidneys and losing them. So please don't look away from what your body is showing you. Now, here is something that most people would never in a million years connect to their kidneys. Skin that feels persistently dry, rough, or intensely itchy, especially on the legs, back, or arms, with no rash and no obvious cause. When the kidneys are not filtering waste properly, certain substances begin to build up in the bloodstream. One of those substances is urea. When urea levels rise, it can deposit under the skin, causing a kind of itching that feels internal, deep, and relentless. Topical creams provide little relief because the itch isn't coming from the skin's surface. It's coming from what's underneath it. Many seniors spend years treating what they think is eczema or dry skin or an allergy, when the real answer is sitting elsewhere in the body entirely. If you've been dealing with itching that doesn't respond to any lotion or cream and your doctor hasn't checked your kidney function recently, it might be time to have that conversation. But what happened next in Harold's story, and in the stories of thousands of seniors just like him, shocked the medical professionals who reviewed the data. A research review published a few years ago found that more than 37% of people with significantly reduced kidney function had no idea anything was wrong. 37%. They were going about their lives, eating their meals, taking their walks, none the wiser. And the most common reason? They were experiencing symptoms that they and their doctors attributed to other things entirely. Things like high blood pressure, anemia, sleep problems, fluid retention, all of which can be symptoms of kidney disease in its earlier stages but are so commonly linked to other conditions in older adults that the kidneys are often the last thing anyone checks. Let me talk about fluid retention for a moment because this one is particularly important and particularly sneaky. Swelling in the ankles, feet, or legs, what doctors call edema, is something many seniors experience and often attribute to standing too long, flying on a plane, eating too much salt, or just bad circulation. And sometimes that's exactly what it is. But when the kidneys can't properly regulate the body's fluid balance, excess fluid begins to accumulate in the tissues. This swelling can be gradual, starting with just a slight puffiness at the end of the day that goes away by morning. Over time, it may become more persistent, more pronounced, and more uncomfortable. The key thing to watch for is whether the swelling is new, whether it's getting worse, and whether it's happening alongside any of the other signs we've talked about today. There's another sign that tends to sneak up on people because it sounds so ordinary, so mundane, so completely explainable by 1,000 other things. Loss of appetite, nausea that seems to come and go without any obvious reason, a general feeling of not wanting to eat, or feeling uncomfortably full after only a small amount of food. When waste products build up in the blood because the kidneys aren't clearing them efficiently, it affects the digestive system in ways that feel stomach-related but are actually blood-related. Some seniors describe a metallic taste in their mouth. Others notice that foods they've always loved suddenly taste different or unappetizing. If you or someone you love has been dealing with unexplained nausea or a significant drop in appetite, especially alongside any of the other signs mentioned in this video, please bring it up with a doctor. Because while it might be nothing, it also might be exactly the clue that leads to a life-changing diagnosis, caught early enough to make a real difference. Now, I want to take a moment to address something that I know many of you might be feeling right now. A kind of quiet anxiety that builds when you start connecting dots. And I want to say this gently but clearly. Awareness is not the same as illness. Recognizing these signs does not mean your kidneys are failing. It means you're paying attention. And paying attention is one of the most powerful health tools you have. The reason I share this information is not to frighten you. It's to arm you. Because the difference between catching kidney disease in stage 1 or 2 versus catching it in stage 4 is enormous. In the earlier stages, with the right changes to diet, blood pressure management, blood sugar control, and medication adjustments, the kidneys can often be stabilized. Their function can be preserved for many more years. People go on to live full, active, meaningful lives. That's the outcome we're working toward. So what should you actually do if you recognize some of these signs in yourself? The very first step is a simple blood test called a basic metabolic panel, which includes a measurement of creatinine, a waste product that healthy kidneys should be clearing efficiently. Your doctor can also calculate something called your GFR, or glomerular filtration rate, which gives a much clearer picture of how well your kidneys are actually functioning. A urine test can check for protein. These are not exotic, expensive, or difficult tests. They're part of routine blood work that many of you may already be getting. The issue is that sometimes results are reviewed quickly, and a gradual change over time doesn't trigger an alarm unless someone is specifically watching for it. So if you have any risk factors, and I'll get to those in a moment, it's worth asking your doctor to specifically look at your kidney numbers and compare them to previous results. The risk factors for kidney disease in seniors are worth knowing because they're more common than most people realize. High blood pressure is the #1 cause of kidney damage in older adults. The constant pressure against the tiny blood vessels inside the kidneys slowly damages their filtering capacity over years. Type 2 diabetes is the second leading cause because elevated blood sugar damages those same delicate vessels. A history of urinary tract infections, kidney stones, or certain medications taken long-term, including some common pain relievers like ibuprofen and naproxen, can all contribute to gradual kidney damage. Even being over 60 itself is a risk factor because kidney function naturally declines somewhat with age, which means your kidneys have less reserve when other stressors are added. And here's something that most doctors don't explain clearly enough when they sit down with their patients. The kidneys and the heart are deeply, intimately connected. When one is under stress, the other feels it. High blood pressure damages the kidneys. Damaged kidneys raise blood pressure. It's a cycle that can accelerate quietly for years. Many seniors who think they're managing their blood pressure well don't realize that poor kidney function is fighting against their medication and making it harder to control. This is why comprehensive care, looking at the whole picture, not just one number, matters so much. Let's talk about something you can actually do starting today, regardless of where your kidney function stands right now. Hydration is one of the simplest and most underused tools for kidney health. Many older adults are chronically mildly dehydrated and don't feel thirsty the way they used to, because the thirst mechanism becomes less sensitive with age. Drinking enough water, not excessive amounts but consistent, steady hydration through the day, helps your kidneys flush waste effectively. If your urine is consistently dark yellow or amber colored, that's a signal you need more water. Pale yellow is what you're aiming for. Reducing sodium is another powerful step. High sodium intake raises blood pressure, and as we talked about, blood pressure and kidney health are inseparable. Most of the sodium in the average American diet doesn't come from the salt shaker at the table. It comes from processed foods, canned soups, deli meats, packaged snacks, and restaurant meals. Reading labels and cooking more from whole, fresh ingredients can make a significant impact over time. This doesn't mean your meals have to be bland or boring. It means being thoughtful about where your food comes from. If you're taking over-the-counter pain medications regularly, and I know many seniors do for arthritis, back pain, joint pain, this is something to bring up with your doctor. Long-term use of NSAIDs like ibuprofen can genuinely harm kidney function, particularly in older adults or those who already have some degree of kidney impairment. There are often alternatives, including acetaminophen for certain types of pain, physical therapy, or other approaches that are gentler on the kidneys. Your doctor can help you find the right balance. I also want to speak to those of you who are caring for an aging parent, a spouse, or a loved one. You are often the ones who notice things first. You see the swollen ankles. You notice they're not eating the way they used to. You watch them getting up multiple times a night. Your observations matter enormously. Don't dismiss what you're seeing, and don't let it get dismissed when you bring it up to their healthcare provider. Be specific. Be persistent. Write down what you've noticed and when. You could be the person who catches something early enough to change the entire trajectory of their health. Think about a woman named Dorothy, 74 years old, who had been complaining about fatigue for nearly 2 years. She'd seen 3 different doctors. She'd been told she was slightly anemic and given iron supplements. She'd been screened for depression. Her sleep was evaluated. And then her daughter came to an appointment with her and mentioned, almost as an afterthought, that Dorothy's ankles had been puffy and she'd been itching her legs every evening for months. The doctor ordered a kidney function test. Dorothy's GFR came back at 42, which placed her in stage 3 chronic kidney disease. She was referred to a nephrologist, started on a kidney protective medication, adjusted her blood pressure treatment, and made specific dietary changes. 2 years later, her kidney function had stabilized. She was no longer as fatigued. Her swelling had improved, and she told her daughter, "I just thought I was getting old." She wasn't getting old. She was getting a treatable condition that had been invisible until someone started connecting the dots. That's the power of what you're doing right now. By watching this video, by paying attention, by taking your health seriously, you are building the kind of awareness that can genuinely save your life or the life of someone you love. Here at Dr. Silas Redford Wellness, that's exactly what we believe in. Not fear, not helplessness. Awareness, knowledge, action. Because the moment you understand what's happening in your body, you are no longer at its mercy. You become someone who can ask the right questions, notice the right signs, and make choices that actually matter. I want to leave you with something important as we wrap up today. No matter what your kidney function looks like right now, whether you've just been diagnosed with chronic kidney disease, whether you're watching this as a precaution, or whether you've recognized some of these signs in yourself for the first time, please know that early action makes a profound difference. The kidneys have a remarkable ability to respond to support. With the right care, the right diet, the right medications, and the right monitoring, many people with reduced kidney function go on to live active, full lives for decades. This is not a death sentence. This is a call to action, and you are already answering it by being here. Small changes matter more than you know. Drinking an extra glass of water each day, swapping one processed food for a whole one, getting that blood test you've been putting off, making the appointment, asking the question. These are not small things. They are the things that quietly, consistently, powerfully tip the balance in your favor. If something in this video resonated with you, if you recognized a symptom, or thought of someone you love, or learned something you wish you'd known sooner, please leave a comment below. Tell me what stood out to you. Tell me what questions you still have. This community is here, and your voice matters in it. If you know someone, a neighbor, a sibling, a friend, who might benefit from this information, please share this video with them. You never know when something you forward might land in front of exactly the right person at exactly the right time. That's how we look out for each other. That's how we make a real difference, one person at a time. Take care of yourself. You deserve to know what's happening in your own body, and you deserve to do something about it. We'll see you in the next one.